Nigeria got some 200 million or something to cover offset Trump's shortfall. So the question I was asking at the meeting we went to was, thank God for Trump that he made my country to bring out this amount of money. So I asked the question, where was that money before? Was it just hanging around? And if Trump had not come, what would you have used the money for? These are questions you should be asking ourselves. That's what I call thinking through away the box and think properly,
There has been this consensus that it doesn't seem like we learned our lessons from COVID, that we seem to have forgotten it. But do you think this development now is bringing us back to the awareness that we hope we had during COVID, or is entirely different?
Two unrelated things.
Mm-hmm.
I don't think we ever learn any lesson, or if we learn, we forget immediately. So for me, when I look at all those COVID things and things, a lot of the times for many African countries, who does all the work in COVID? It's all from outside, isn't it? All the support, all the equipment, it's all donated and brought in from outside. So what lesson are you going to learn from that? That you are not done with yourself. Maybe the closest to what we've done was the Lagos thing, where Lagos State, I'm not talking of Nigeria, Lagos State, when Ebola came in and they quickly did some good job, yeah, with some external assistance, but it was mainly directed from within by the ministry itself. They went out and did all the community. It wasn't the external people who traced all the contacts. These are people at the local government who knew their people, who went after them. And when there was a contact, when there was a case, they followed the contact, went to all the local governments and everything. So it was something done internally. Yes, there was support from outside, but it was us that did it. And then you can learn lesson, you can look back on that. So when COVID came, Lagos State was ready. But when every other thing that is happening in many parts of the world, WHO takes over the activities in DR Congo and all that, they will not learn nothing. Because those who have the experts who have come, they will do it and go away. The local people are just bucket holders and whatever. That's what they do. So what lesson are you learning from that? But when at least you do most of the work yourself, then you have experience. But that's not to say that we don't have people who have experience. During the Ebola, DR Congo was sending people out to other countries. And after that, some people were going from this country to other places. So in a way, there are a few areas where we have learned. But I think the error we're making is that we're not building on those strengths that we have. I used the word, I said, we disdain our strength and clamor for our weakness. By, for example, how much does it cost to put a good public health division, epidemiological division in place? How much does it cost? One or two vehicles, have people on the ground. They can give them petrol to travel when it's an epidemic. When something is reported from one little village, they can go there within a second. Don't wait for it to spread like it did in Guinea when it got into Liberia, and nobody did anything for 3 months. So if you get your people, give them those enabling conditions. The guy who is in charge of a PID at the local government, who is also in charge at the state government, they link into each other. The guy has a bicycle to go to the next village and go and look at the cases. He's trained enough to be able to collect the right sample. He has no lab, so he has the facility to ship it to the state level that does the first whatever they can do. What they can do, they move on to a higher level rather than what we have now, where we have a King Kong NCDC that oversees everything and controls everything. The cases are not occurring in Abuja. The cases are occurring in my mother's village, where NCDC has no clout. So why don't you build up those that which was what we were doing before? Those PED staff, those epidemiological staff who can be on the field, who can investigate, who know their community, who know who and those who are sick, give them amount, $200, whatever. They can go to where they want to go. Rather than, I was telling one of the governors, I said, between your office and your house, 20 cars will follow you in your entourage. The epidemiological village state P division that is next door there, they don't have a bicycle to go investigate something that happens 5 kilometers away. So when they call us resource limited, we are not. We are resource wasteful and we're resource squandering. And that's what we are. And if you don't know what you are, you will never find a solution to your problem. So back to what I'm saying. We have enough. I'm not sure there's any continent that has more experience in investigating disease epidemics than us in Africa. You can take it back to yellow fever in 1776, Ebola in 1997, I think. It followed whatever, everybody. So over the years, we have been gathering experience. People were trained. The only reason they're not functioning is that they don't have the wherewithal to go on and do the listen. They don't have syringes. They don't have the whatever to take blood samples. They don't have the bottles. They don't have the materials for sample collection. They don't have the vehicle to go to the places. And I kept asking the question: how much would that cost us compared to us begging for vaccine or buying vaccine from outside? So we're putting our focus on the area where we have weakness and forgetting the area where we have strength instead of building on those ones. And that's why I'm very quite excited. As I sent to you, I'm excited about Trump. May he never change his mind. And it's not that this is a wake up call. He has woken us up before when he came in 2016. He withdrew from WHO, didn't he? So it's back again. So are we now saying it's going to be different from what he did then? So when anybody says it's a wake up call, I said, no, he woke us up before. We went back to sleep. And that's why we are saying wake up call. It's like what is happening to Lassa. You know Lassa in Nigeria. Every January we make out noise. We've known that it's going to be happening from October to January every year since 1969. But each year is like something new has come. And you say we have learned lesson. Which lesson? The lab there in the NCDC, every year they get 9,000, 10,000 cases, suspected cases of Lassa. They're able to confirm 1,000. Nobody has sat down. I asked them. Nobody has sat down in the place and said, all these 8,000 extra, which we couldn't confirm, what are they? What laboratory things can we do to find out what those 8,000 suspected cases are? Every year we jump up over 10,000 reported. We confirm 1,000. And then we go on next year, the same old story. Is it somebody sitting down there in the NCDC and saying, look, I mean, all these 8,000 that look like Lassa fever, what exactly are they? Are they negative because I've collected the samples wrongly or because it's something else that is causing the problem? That's the thinking. What did they tell us? They said we should think out of the box. I said, who put you in the box in the first place? Why should I be thinking out of a box? Box of donuts box? Throw away the box and think like a human being. So that's why we have not learned any lesson. Or if we learn, we forget it almost immediately. I just sent you something where it says Nigeria got some 200 million or something to cover offset Trump's shortfall. So the question I was asking at the meeting we went to was, thank God for Trump that he made my country to bring out this amount of money. So I asked the question, where was that money before? Was it just hanging around? And if Trump had not come, what would you have used the money for? These are questions you should be asking ourselves. That's what I call thinking through away the box and think properly.
One of the arguments that people that we are hearing is the concern that the health sector's running cost has become so large that it may be difficult to continue to do things. For instance, we know if you look at malaria, there is free treatment at some centers for women and for pregnant women and children. We also
Yeah.
have free testing, and the society has gotten so used to that.
And they're adding kidney and renal what's in now recently. They're adding more now. Anyway, go ahead.
Yeah, so the reality with the reality now, what is realistic? Can we now say that we are no longer doing all of these things for free because we are now started with responsibility of financing it? Or how do you expect the people to get used to that?
First and foremost, I mean, again, a lot of this is knee-jerk reactions. A new government comes in, what's the name of their renewed hope or something? I can't remember what they call their new government. So they come up with all these governments, new things that are not sustainable because, it's a political thing. In a way that, let me tell you my own attitude. In a way, the money that we are wasting, at least some of it is coming back to the people one way or the other. It's not the ideal situation, but one way or the other, whatever money goes into all those things is out of the fingers of those senators to spend anyhow. But that's a temporary thing. But secondly, we should think differently. People have talked about the NHIS and all those kind of things. And back to what this is. Why should we continue to have so many cases of malaria? Why are we not doing the prevention? Why are we doing the control? Even your NCDC has the name National Center for Disease Control and Prevention. I don't think anybody remembers those last two words as their name. But in any case, in fact, I would think they should change. I would suggest to them that they should restructure themselves and call themselves National Center for Disease Prevention and Control. Because what we're doing now, we are poorly controlling what we have failed to prevent. But if we have prevented all this things, for the amount of cost you are talking about for malaria treatment for this thing, will not really be that much because you have done prevention. You have put part of that money into prevent. If you prevent, then you are not treating. If you prevent, you are not spending money on treatment and all those ones. And it's the same type of argument when people talk about 15% for health and all that. And I keep asking them, I said, what has anybody ever shown us any document to show how they arrive at the 15%? I've never seen any. I've checked to find out these are the parameters we use to determine, okay, 15% will be good for health. But even then, let's assume that. And then when you do something, that was 2001. This is 2025. You've done something for 20 years, you're not able to achieve it. Shouldn't you rethink it? How many countries have reached 15%? And how many countries have sustained 15%? So Nigeria has never reached up to 10%. It's only around 5 or 6. So if you are not able to reach that 20 or 15%, shouldn't you sit down and think, why am I not achieving? Is it realistic in the first place? And secondly, if you put your money into ensuring that your people have good water supply, how much of health diseases do you reduce? Dysentery, diarrhea, all those kind of water-related diseases. It's no longer your problem. Why are we not counting all those as part of what we are contributing to health? The simple thing about girl child education, mother education, community education, all those things, they all contribute to health because part of prevention. So why are we not focusing on those areas? Take the monkeypox that is going on in DR Congo, because we know the insecurity around it makes it impossible for them to do proper surveillance and all that. In the last a few months ago, you probably read about some outbreak in DR Congo, which they said it was a strange disease because the lab couldn't detect. Only they found out it was later malaria. I don't know whether you read about that. There was another one that also comes, mysterious disease, all this and that. These are simple laboratory detection or something of that nature. See what happened with Tanzania over Marburg. For 3, 4 different laboratories, they said it wasn't Marburg, only they finally got it right. Those are some of the things we should be putting our money on. Put all those preventive things in place. So we won't have to spend so much money treating people about malaria or giving dialysis because we are not preventing what is giving them, making their liver their kidney to go to pieces. So it's okay. For now, it's an action. We see that government is doing something, but it's not sustainable. Number one. Number two, we need to go back to the basics. What are the things we need to do to prevent malaria? What do we need to do to prevent all these other things you're talking about? HIV itself. What are the cultural things and social things we need to do to prevent the number of cases, to child transmission, all those kind of things, What are we doing to prevent those ones? Rather than wait until we have the case and then beg Trump for drugs to treat those people. So to me, I think it's a shift from controlling to preventing. And I keep saying we have enough resources, we have enough talent, we have enough experience, we have enough people, background, who have this background thing. If you just equip them, the enabling environment for them to function effectively, we probably won't be needing all the situation will not get to fake international concern or whatever. It will have been a local concern, which you have taken care of. It will be your state concern. It will be national concern because you have handled it right from the beginning. So to me, that's what what we're doing is a palliative as far as I'm concerned. But for how long will you keep palliative if you don't address the original thing that caused the palliative in the first place, or that caused you to be supplying palliative in the first place? So that's to me.
Are you concerned that we are gotten so used to the current structure of how to do things? It seems to be repetitive. That this is how we fight malaria. It has to be this way. That bringing about intentional change in the way things are done seems to be almost impossible.
That's why I said throw away the box. When you tell me think out of the box, I'm still constrained by the box. We're still constrained by what is around. People are not even thinking of what other alternative do we have. We go the same way, the same budget comes in, is allocated. This one, that, all those kind of things. That's all we're doing. The time has come for us. Some of the points I'm raising about the fact that why are we clamoring for vaccines and international aid when we can put our resources into building up at the grassroots level the issue of prevention, early diagnosis, community involvement, and all that. And again, I ask, how much is that going to cost us compared to us waiting for vaccines and things of that nature? Yeah, we've sunken ourselves into that situation. But one other area which I think I'm so, I sent you something. I said USAID was one for international destruction and dependency, and that's what it has become. It's not today it started. I went through, in fact, my secondary, my university was a USAID project, I mean the veterinary school. And then I went on to work in Rockefeller Foundation Institute. Then I went to work in WHO. Each of those places I've seen how toxic donations are to us. And part of it is that the Bible said it. The man who gives benefits more than the one who receives. That's what the Bible said. And that's what the real life is. So it's not just the Bible alone saying it. The time I was in the veterinary school, I knew how much all those expatriates came in, how much of that money actually came to Nigeria and how much went back to their own country. When I was in in the Virus Research University, Rockefeller Foundation, we were ordering mouse cubes for feeding our mice from US out of the ground. Yet there was a company in Ibadan here, Ladokun Feeds, that was making these cubes that other people were using. But in the research lab, we had to go to Apapa to go and pick up bags and bags and bags of mouse cubes. All that money accredited to this thing. In WHO, when I was there in 1997 or thereabout, there was a plan to start what we call integrated disease surveillance in Africa. USAID came up and gave out, I think, about 100 million or something around that. But whom did they give the money to? Not to Africa. They gave the money to CDC Atlanta to set up integrated disease surveillance for Africa from Atlanta. Of course, the first thing they did was to open up an office for integrated disease surveillance in Africa. We were recruiting and equipping and recruiting people from Florida and other places and charging all those who stood the ground. While they were doing all this, Africa itself did not have a single office, a single staff to do integrated disease surveillance. So at the end of it all, 60, 70, 80% of that money went back to US in one form or the other. And you know one thing they do? For example, if somebody from CDC is coming to Africa on the basis of that grant to do integrated surveillance, officially, CDC will not pay him for the number of days that he's working with us in Africa. They will deduct his salary from the grant. And when you look at, the salary of a researcher in Africa, the salary of a researcher in CDC, take that out of your grant, what is left? So they send 10 of them here. They will say for 10 days, multiply their salary by 10 times 10. And you know what I'm talking about. So is it that we are so blind in Africa that we don't see all this? Or because our leaders, see it as, they can opportunity to steal our money and misuse it. The other day I was going to Lokoja for a meeting from Abuja. One of the cars took us all the way. But as we were coming along the way, two dispatch riders came and drove everybody off the way. And we had to wait by the roadside. Why the governor was going back to Abuja? What was he going to do in Abuja? Nobody knows. I counted 20 cars on that entourage. So those are the kind of things. But then we go to Lokoja and the State Department, the P division, doesn't even have a bicycle. And some of those vehicles that my guy was driving around, there was nobody inside except the driver. I'm sure if they have money, they will buy Tesla's car that does not require a driver. That's the kind of thing they want to buy now. So these are the issues. You raise the point where we're set in the ways we do things. Those who are making money and make money out of it. The poor people who are totally ignorant of what is happening, don't even know what is going on. And so we continue on that. And that's what I keep going back to say, that I'm not going to be thinking out of the box. I want to throw that box away. And I want to think, the things I'm seeing. When I'm inside the box, I don't see outside the box. So those are the issues. I agree with you. All these new things they are putting on, it's not sustainable. It's not sustainable. And
Okay.
anyway,
I'm curious.
they are setting about 2 or 3. Take the issue of the dialysis and all those kind of things. How many places are they doing it? What areas? What's the reach? Yeah, I've
I'm curious to know your perspective on the response so far from the continent, different African governments, how they are responding to these developments. So, what do you think we
funny
are
enough, I
getting
can
right?
only talk much about Nigeria because there wants to be too much information about the other countries.
Yeah, let's talk about Nigeria.
Yeah, for me, I commended the government for that. It didn't take 2 days, maybe a week, for them to make up their mind that look, they needed to get some money to meet this shortfall. Then they're still focusing it on HIV, mother to other kind of things. Yeah, but that's the first step. And the fact that we didn't have to wait for a week, 2 months, 3 months to do it is evidence that if we mean to do something, we can do it. And then that was when I asked the question at the conference. I said, where was this money before? And secondly, if Trump had not frightened us, what would we have done with the money? So these are questions that we need to begin to, so that we can sustain it. So if that money was there before, did we reprioritize something? Was that money budgeted for something and then we reprioritize it because we think this is of a higher priority? That's the way we should be doing our things. We can't have money for everything, but we must build out our priorities and say, on this base, this is the most important thing to try, therefore put the money there. Like I gave an example, I said, I'm a father. The school fees for my child is end of January. I wanted to buy a pair of shoe. I don't have the money for both. Will I go and buy the shoe and my child will not go to school? Or will I go and pay the fees, and hope that next month I can have money to buy the shoes? That's prioritization in simple life. So a country should be able to look at this. What are those areas of our life that we need to put immediately? And we don't have to hang on donors for my life to be whether I'm eating or not. Like I used to joke, I say, when we're making all these babies, we don't call the donors. Come and take care of your children. You start asking donors to come. Doesn't make sense. So those are the things. I think it's a matter of reprioritizing our problems. I mean, whatever situation problems, and then putting our money into those spaces and cutting our waste. Because this money must have come from somewhere. And like I said, if it was not meant for a project, it was meant to be stolen and stolen. Other things. Cut our waste. Reduce all the waste. Go back to the House of Assembly and all those people they are talking about. Each of them bought, what kind of car did they buy for themselves? And yet there was a company in Nigeria, Innocent, that was making cars like that. Why didn't they buy from there? The dry dock that China built for us in Lagos, the money was not given to any Nigerian company. It was given to the Chinese company to build. But then we're going to be paying the debt in future. But it was a Chinese company that got the money. They're building their own economy, giving more work to their own people. A man paying that interest for that to them, for taking care of their own self. That's what donation is all about. So I don't see why it is so difficult for us in Africa to see it like that, and then sit down and whatever it is little we have, make use of it. Back to the time before we got oil in Nigeria, each of the states they had nothing. We had cocoa in the west. They had coal, I think, in the east, or palm oil or whatever, and the north had granite. Each of these people introduced free primary education, loans for students, all those kind of things. We had no resources then, but we made good use of what we had. Now that we don't have the money in excess, what are we doing? They're bunkering them, they're stealing them, they're doing all those things. So those are the issues. Those are the things that we need to look at. I believe we have enough resources to do the basic things that are essential for our life. Over.
For a program like malaria now, how
Yeah.
can we realistically streamline our response, be very effective, minimize costs, like you've indicated, and still ensure that the progress that we've recorded so far are not sacrificed because of this major disruption?
Yeah. There are a few countries in Africa that are now declared malaria free. And yeah,
Yes,
Cape
yes,
Verde,
yes.
a few others. I mean, about 3 or 4 of them are now declared
Hmm.
malaria free. They didn't use any vaccine. What did they use? There are other 3, 4, 5 different issues around malaria: bed netting, vector control, therapy, whatever it is, all those kind of things. We cannot focus our attention only on the vaccine. The first and most important thing is prevention. If you deal with your mosquito population, if you take care of your water problem where mosquitoes are breeding outside your house, if you take care of cut your grass around the areas where it is in, all those are contributories to malaria and reduce your need to treat cases. So each of those other bullets for malaria control, why are we not focusing on them? We are waiting for donors to come and give us. The donors are not going to give us money to control mosquitoes in our village. It's our own. And when were we not doing it before? I'm sure you have heard of the term of wole in those days. These are sanitary inspectors. They were going around ensuring that people kept below your gutter was well clean. There was no pool of water around your house and those other things. Those are basic things that we. How many expatriates came to Africa and came back? They managed to survive for as long as this thing because they live in houses that had mosquito nets and all those kind of things. They knew not to go out at night. They stayed in their own places. So there are practical things that we can do with minimal cost. At least significantly reduce the number of people that are coming down with malaria, which means you don't have to treat them. which means you don't have to spend money on those drugs. And so if you can do those basic things, don't abandon any of them and put your emphasis on that. Let me give you a good example. How much does it cost? What factory do you really need to make impregnated mosquito nets, bed nets? Is there kind of factories can do that? The whole of, arrow. How do we make arrow in Africa? It started before the
Mm-hmm.
Europeans came. How can we not now be the people to make impregnated bed nets? Why are we not putting some efforts on those kind of area? But set up your factory, you get more job for your people. They make the nets for you. You have your team that is cleaning your environment. You keep your environment, individually keep your house. And what used to happen in that day, they didn't need any government person to keep your house clean. You kept your house clean. Therefore, the next door house is clean. Then the street is clean. And then the village is clean. That's all. So each of us are contributing to it without too much cost on our own self. I mean, you still have to keep your house clean anyway. You sweep your house every day. Those are the basic things we should be emphasizing, and let people get involved, in part of it. Government can direct, and that's one of the things I always quarrel with the NCDs for. I said, it should be National Center for Disease Coordination, Disease Control. They're not controlling nothing. The basics, each state should have its own state center for disease control or whatever, disease coordination or whatever it is. And my big boss in Abuja coordinates all the activities, offer them assistance where they cannot. But activities should be at those local government level and at the state level. Not the kind of thing we're having. I use the word King Kong, the National Center for Disease Control that we have. So we can reduce all these things we're talking about. And again, back to what is happening in DR Congo, where monkeypox suddenly has become a major thing. Most of the problem with monkeypox in DR Congo is actually because of insecurity, and people can go out and walk and investigate disease. People are running helter skelter in one different places, all those kind of things. So there's no peace. So you can't organize anything. So that's one major issue. But we have examples in Africa in which we have gone down to the basics and controlled. Again, back to our country, Nigeria 2014. How many cases did we have? Only 20. And 8 deaths, or 11 deaths, I can't remember the number. So that was what happened. Even though, we had somebody moving out of quarantine into Parakot, even though we had 2 locations, we still were able to keep this. How did we do it? We didn't use any vaccine. It was community involvement. It was case tracing. It was isolating the case. It was treating the one what drugs were available for treating Ebola in 2014. There were none. We didn't have any. And yet, we reduced the number of cases. And I can give you examples of other countries that did other things. Uganda was, being close to DR Congo, had cases of Ebola coming in, and they've nipped it in the bud. Kenya had an outbreak of anthrax in a village, and they nipped it in the bud using basic, simple diagnosis, surveillance, contact tracing, and all that. It didn't cost the country a fortune. Why do we wait and neglect all those things? Quick turnaround of your lab and all those kind of things. Let me give you one good example where I think we're very. You remember during COVID, when we started, they said Nigeria had only 3 laboratories that could do COVID. And within 6 months or so, the numbers went out about over 100 labs were now set up. Every state was setting up labs. But do you know, if you go and check the NCDC website, 6 months after that, 60 of those labs were no longer functioning. And what happened? Because either they didn't have reagent, they didn't have staff or something. They were not paying their staff. When they were setting up this, the guidelines were given. You have 100 naira, 50 naira for building the lab, 30 naira for reagents, 10 for staff, and 10 for that. Somebody in the state will pocket 80 naira, and they want to build a lab with the remaining 20. Of course, that will last you for three months or so. And that's what happened to many of our labs. Today, if you go and find out if an epidemic comes to Nigeria, none of those labs will be in a position to do any tests again. So that's the wastefulness I'm talking about. It's not that we're not resource limited. We're resource wasteful and we're resource country. We need to address all those issues if we ever learned any lessons from the past. And I keep saying the little lesson we learn from the past, especially maybe in a few states. But in the case where donors were the ones that did virtually all the work for you. Take the DR Congo area, for example. Most of the work is there. Donors come and go and something. The samples are all in place. Go to Liberia, go to many other countries. Do they have the people to continue the work that the donors came to do? So you unleash a host of 10, 20 international donors, investigators on the field during an epidemic. They all go away. Your own people are just following them at the back. You don't even have the data of what you are reading. Of course, when they go away, you are as ignorant as when they came. So that's what is happening to us. But if you have put your own money there, you have put the man there, and he's the one who's in charge. Every year there's a budget for what he's doing. Those experiences are there for him. And so you can learn a lesson. You can say, oh yes, when this happened in Kenema last time, this was what we did. But for him to get information on what happened in Kenema, he has to go to John Hopkins. So that's our problem. That's our dilemma.
That's quite thought provoking. But in spite of this, what are the concerns that the general public will not be the ones that would really suffer from this?
For me, again, unfortunately, you asked me about other countries. I don't know what other countries have done. I still believe that first is a wake up call. I mean, although we slept off when the first wake up call comes. Okay. So this, to me, is an opportunity for us to see if, assuming this no more aid is coming, are we going to just fold our hands and say no? And the example which our government has done, somewhere, they're able to get that money to you know, block the shortfall, shows that if we spend our money well, we can do it. I have confidence that, this is something I think we can learn from what has happened now. This is something we need to continue to tell our people. This is what our government has done to meet this shortfall. Let's encourage them to continue to do that kind of thing. Think right, reorder our priorities. If we do that, our people won't suffer that much from all this. I even think the people in the United States are probably suffering more from Trump's activity. Imagine the number of USAID workers that are no longer going to work. Where are they going to? They will lay them off, Abi, in the
Yes.
US.
Yeah, I
So
think so.
it's also affecting them in one way or the other. You know,
Yeah.
I can imagine the number of agencies that people that are working in other agencies here who are being paid, who have work. This thing will affect them. They too will have that kind of problem. So let's think along that line that even the things affecting their own people, we shouldn't. Why should something another man is doing in his own country have effect on me? So I should come and look back and say, look, enough is enough. Thank you, your government. You've done this one. All those things you are introducing. We hope that if you cut our waste in this area, we can sustain what we are doing. Or better still, we can have a better way of reducing the occurrence of all these diseases and all these outcomes of wasteful living that we're living, the kidney problems and renal issues and liver disease and all those kind of things that we're getting, antimicrobial resistance that we're getting. We can change all our attitude. So attitudinal change is something, but then you must be able to show all this evidence to our people that look, see what is happening. When this happened, and I gave the example of the countries that how did they manage to? We should go back to all those that countries, I can't remember them, that have taken care of malaria without any vaccine. What did they do? What exactly did they do? Can we learn from them? These are the kind of lessons I will not on the past experience that, okay, so we had epidemic before, of which we had little or no control, what we're controlling it. So what were we learning? And the only one, and I think we need to again begin to raise this point, the issue with Lagos, 20 cases and 8 deaths, how they followed up on that on COVID, how they built on that on COVID. Those are the kind of things we should be announcing and telling our people. It is possible. It is possible. If we remove this condemnation and put this money into those things. And we have experience. It's not that we don't have people. I use the word creating the enabling environment for your build capacity to function. And because they don't have that, that's why they are jackpine. Because you don't have my generation stayed because thanks to Rockefeller, you may want to say that we had a lab where we could work, we had reagents, we had everything we had. But interestingly, and that's why we don't learn that lesson. Those committees, those funding that came from Rockefeller and all that, they had a time limit. 10 years. After that, we knew what we went through because our government wasn't prepared to take over those things. We should have learned from all those ones, but we're not learning. Yeah. I still believe there is hope. I believe that by us pointing out, again, I hope you're able to find out from other countries what they too have done against to offset Trump's this thing. It will bring such kind of stories around, telling our people that so the money is there. See what we have done now. See the independence we have gained. See how we have taken care of our people without depending on donors. We did it in small bits. Let's do it increase it with the resources that we have. Over.
So let's talk. Let's close with the optimism you mentioned. What are you optimistic about?
Ma'am, okay, we are seeing changes in this new government. In fact, the meeting we went for so what they call unlocking. I can't remember how they put it. Unlocking the values that we have. Uh, Diagnostic values, producing our own reagents, making vaccines, and therapeutics and all that, and integrating all this together. Because if you have good laboratory diagnosis and your good surveillance, then you can detect these cases as quickly as possible. You don't have to have an epidemic going on. And if you don't have an epidemic going on, of course, that means you don't waste money on the emergencies that you do. You can plow that money back into improving your facilities, ensure that the cases are nipped in the bud even before they become a major issue, that kind of thing. And I believe that the money we will save in terms of preventing those big outbreaks, if we get that money plowed back into improving the prevention, then of course it's a continuous exercise in. And again, as I said, when you weigh that amount of money, people talk about the fact that look, health is just consuming. I say, yeah, let it consume. But one disease outbreak will consume all the economy you have done for the last 20 years. COVID did that to us. Sorry, Ebola, maybe COVID. Yeah, COVID also. So by not putting money into preventing COVID or Ebola, all of the years of economy you have built up, go and see Alaba market during the COVID period. Nobody was in the market there. So count how much we lost on that one. Take 1/10 of that and put it into prevention. You see, we'll be in a better state than we are right now. So my optimism is that sustaining what they are doing, and I believe we can sustain it. But come 2027, we're going to have another election. We don't know whether he's the same man. In fact, I hear he's going to become governor in his state now. So we don't know who's going to be the next minister of health. That one can bring in a new thing which does not. So sustaining what things we have built, that's one the area of optimism that we'll have. That the next people that are coming will improve diagnosis, will improve production of vaccines, will improve production of therapeutics, and build on those ones, working together with the private sector and assuring that all these things that we beg for, we actually can produce them ourselves. I raised the point about the fact that why is somebody in NCDC not thinking that look, we should improve our diagnosis? Why am I having 8,000 suspected cases of Lassa fever every year, and I'm only able to confirm 1,000 of them? Shouldn't somebody be thinking, so what are these other 8,000, 7,000, 90% that I'm not able to confirm? That's what our NCDs should be doing, thinking globally for the country. Leave the basic investigation of disease, going down to cases, leave it to the states and local government. The last exportation of, I think it was monkeypox out of Nigeria. Yeah, I think it was monkeypox, if I remember. Or is it COVID? Anyway, into one of the states in the United States. It was a local government, their own local council, that did the diagnosis. The only time they called their CDC into it was because it now involved international travel. Where did this guy come from? They had traveled to Nigeria, they came back. So tracing who are the people in the plane, what country they come in, that local government can do that. So they hand that over to their CDC. I was not able to go and trace and see this man came from Nigeria. These are the following people who got contact with him. They are now based in Iowa. This one is in Georgia. That one has gone to. That's the duty of the CDC, not going to diagnose monkeypox for a case that comes to my village. So if we orient ourselves, give a proper activity and equip each region to do its own, we'll solve our problem. It will not be as costly as we are making it look like.
I'm curious to know why it seems like stakeholders like you seem to be optimistic about the current leadership of Nigeria's health ministry.
I
Okay,
used the word
what?
now, and I said sustain.
Okay,
We don't know. I said 2027, we know what's going to happen. Even if this same government comes in, it may be a different minister. I may not be doing what he's doing. This one actually virtually brought his own team, almost totally overhauled the whole ministry. The people who are doing all the work around him are people that he brought himself. I don't know how we can sustain that. No way. Because the civil service is that's the consistent thing that we have. And if you're not getting them to be part of it, then you're creating problems for everybody. So except he stays there forever as minister, yes, maybe, but he cannot. And we don't know exactly what the next minister is going to do. It was the change of government that made us want to have a bio vaccine up to today. It was settled in 2005 when it was set up. A new government came in 27 and dissolved the board. For 10 years, nothing happened until 2017 when we started a revival. In between that time, we had about two ministers. One was interested, the other was not. So the sustenance, unfortunately, depends on the political leadership. And so they come in with new things, which, during the period they are there, they will sustain it. But if they don't win the next election, then there's no guarantee that it will be sustained. So it's not the kind of optimism that is doing. It's a hope. I think there's a difference between optimism and hope. The optimism, you are sure. When you say hope, you are saying hopefully if it happens, then the optimism comes in. But it goes side to side, side by side. You cannot be optimistic when you are not sure what is coming next. You can only hope if you hope that what is coming next is going to, then you're optimistic that the future will be better because you already have something on ground to hope on. So there's a slight difference between being optimistic and being hopeful. I mean, for me, I have the last thing to die in me for Nigeria is hope. The day my hope for our country dies, then I won't even be talking to you. I won't be waking up and going to Abuja to attend meetings and at TV programs and all those things. I would just stay in my hibernation and walk around my house. And incidentally, I have a hammock at the back of my yard. When the sun goes down, I go and sleep in my hammock. That's what I would have been doing. But I still have hope that if it happened for me, why should it not happen for my grandchildren? That's the hope I have. And that's why I keep talking and keep getting interested in what is going on. I'm pointing out to them. I've never stopped talking to them. They like to hear. That's their own problem. They can't do anything to me anymore. Even when I was young, they couldn't do anything to me. So you see now they will do something to me. Absolutely not.